Nigeria is home to the third largest population of malnourished children around the world. According to UNICEF, about 2,000 children die every day as a result of malnutrition. Today on Sound Health, this is our focus. I am Olasumbo Modupe. It's so good to have you on the show. The program continues in a moment. Please stay tuned.
Nutrition is important at every stage of life. From the early years, optimal nutrition ensures children grow and thrive. School years are an important time to develop healthy habits. And these smart decisions should always be encouraged to ensure health and well-being for all, at all ages. Nutrition is particularly important at some stages of life, like during pregnancy. For enjoying a long, healthy life, it is a good practice to have regular checkups and eat healthy diets. Optimal nutrition is one of the greatest gifts you can give yourself and your loved ones.
It is still Sound Health on Lagos Television. Joining us now to share his perspective on malnutrition, how to scale up nutrition in Nigeria, is the Executive Secretary, Sunday Okoronkwo. He is the Executive Secretary, Civil Society Scaling Up Nutrition in Nigeria. Good afternoon and thanks for joining us again.
Good afternoon. Thank you for having me.
Alright, about 2,000 children are lost every day as a result of malnutrition. How is malnutrition an unseen enemy in every household or in the country?
Okay, I'll start by painting a picture. Assuming, God forbid, of course, we have a football field with about 1,000 persons, and the bomb explodes. That's a calamity, and before you know it, you have probably all the news in the country carrying that as breaking news. And, I believe the government will take drastic steps to see what they can do to probably do something about the situation. But malnutrition is a challenge that is I would have not as exposed as, for example, the picture I just painted, because one, it's driven by ignorance. Not every family truly understands or know what it is, what causes it, and probably how to prevent it. And the truth is that in so most family, it creeps into them. Maybe when a baby gets sick and things like that, the first thing the mother thinks of is probably the child has malaria or typhoid or something. But because he or she, doesn't really know what it is and has not probably ever been educated on what it could be, you find that instead of seeking the needed help, they may want to, do one or two things to see how they can probably save their child from that situation. So ignorance is one of the major things that makes it, a hidden enemy. Before probably they realize it may be too late, and some families end up losing their children, especially the ones probably don't have access to, quality Medicare or access to even primary health care centers where they could seek the help and interventions of medical personnel. So it locks in most families. It, just creeps on them, and before you know it, it becomes unbearable. Maybe like stunting also. of course, which may have been caused by lack of quality nutrition, maybe poverty, level of the family, lack of hygiene and the rest of them. When the child, probably digresses, becomes stunted, wasted, and the rest of them. Instead of them, because they didn't know that some of those practices or some of those things could lead to malnutrition, you see them not doing anything to probably take some of those steps to prevent some of those actions that could have led to the challenge they have in their home. So it's not readily known by all. It just creeps in on families. It's called a silent crisis because all over the country the problem is there, both in the house of the rich and in the house of the poor, in densely populated areas, in where the rich and mighty are. We have what we call overweight and obesity, which is excess intake of nutrients, and of course in the poor areas you have deficiencies of these nutrients that could prevent malnutrition from occurring. So I think that's how malnutrition operates. It thrives on ignorance. It thrives on, to some extent, lack of nutrition education. And so it's an enemy that not every family knows is lurking behind to cause harm to the family.
From your response, I can pick about two terminologies: stunting, wasting, and micronutrient deficiency.
Yeah.
How do you explain this to a layman? The effects of malnutrition. How do you tell? A layman will feel, if you ask a man, okay, why is this boy shorter or thinner? They will tell you, he got that from his grandparents, he got that from his mom and all that. How do you tell a layman the differences and the effects?
First and foremost, they need to understand that malnutrition is real. They need to know that it is a situation that occurs when their children don't take the required nutrients, or on the other hand, when they take excessive of those nutrient intake, it could lead to obesity and the rest of them. For stunting itself, it impairs not just the physical stature of the child, it also affects the mental growth, mental well-being of that child. The brain, is underdeveloped as a result of stunting. And so to a layman, basically, what I'll try to do is to, one, explain what malnutrition is. Example, I know that this slogan is known by almost every Nigerian, that you are what you eat, or we could also add, you are what you don't eat at times, because if you don't take the kind of food that gives you the required nutrients, of course you are tilting towards becoming malnourished. And if you take what your body requires to function optimally, then you are tilting towards optimal nutrition, both for yourself and for the children. And so I think letting them know that what you eat is important, and that you can eat from even what you have at your backyard. Letting them know that there are different classes or groups of food, that you can pick from more than one group of food to make sure you have what we call now adequate diet. That is to say, a food that is balanced both in quality and in quantity. You'll also let them know that if you observe, for example, that your child is maybe when you go to the hospital and your child is weighed, or you weigh your child at home and you find out that her weight, his or her weight, is not what it ought to be, you haven't known what the weight should be, then you should seek help immediately, because there's trouble lurking if you don't do something about it. When you give birth to your child at the hospital and the child is weighed and that child is not up to 2.5 kg, you know that there's a problem. You need the help of an expert, and so on and so forth. Wasting itself is caused also by lack of required nutrients, and then most times it's coupled with illness. And most times you see children who are wasted, being too thin for, their height. Of course, if you observe your child, looking too thin, not eating as he or she ought to eat, of course you should seek help. Whatever you don't understand the help of your children, go to a health expert to help you identify what the problem is and take steps to fix them immediately. So I think to a layman is to understand what malnutrition is and understand what he or she ought to do to prevent them. And in a situation where he or she doesn't know what's happening, you go to an expert to help you identify what the problem is.
Childbearing starts from even before conception, from the teenage years and all that. But if you were to look around, you will realize that some will tell you there are some cultural and religious biases, that impede the normal transition a woman is supposed to experience from the teenage years to, adulthood now. What do you think we can do to change the narrative when you talk about impacts of cultural and religious biases when you're talking about nutrition?
Yeah, I will start by stating...
Because at times you see a pregnant woman, they will tell her, don't take a certain beverage just because it might affect the size of your baby and all that at birth.
Yeah, but that's a major challenge, and that's why we say ignorance and lack of the appropriate knowledge of what you ought to do or the parents ought to do is what drives malnutrition. Malnutrition itself is like a vicious circle. It is a vicious circle that moves from that teenage girl who is already undernourished or malnourished, who or maybe gives birth too early at that adolescent age, or even grows up to a period being malnourished and not having quality nutrition, delivers a baby that is of low birth weight, which is already a challenge in itself. And because also probably poverty, lack of hygiene, lack of access to adequate nutrition, also it's not able to take care of its baby, and also as a result of lack of knowledge, does not exclusive breastfeed, know anything about complementary feeding, that child of course would grow with same challenge to an adolescent who eventually becomes a mother, and the vicious circle continues. Now, what we're supposed to do is know that for a child to have optimal nutrition, which is the goal of which should be the goal of every home, is you start from the nutrition of the mother. Maternal nutrition is important. The mother herself, even before she gets pregnant, should have access to quality nutrition. Quality nutrition, and ensure that she has all the vitamins and minerals she needs. For example, women like who are pregnant need blood, iron, folate, and things like that to help them to prevent anemia, which is dangerous. Could actually lead to that woman losing his or her baby. And so that woman, even before she gets pregnant, with the support of her husband and family, requires quality nutrition. When she gets pregnant, and that should also continue, she should have access to quality meals. Now, I know that in Nigeria you have so many religious beliefs and myths that ignorance have been driving in the country. For example, they tell you that if a pregnant woman, some sections say if a pregnant woman eats snail, your baby will be too slow crawl. They tell you that how would I put it? Taking egg and the rest of them could cause your baby to steal and what have you. All those are just stories that are not true. The only thing is that the mother shouldn't overtake it, but she needs adequate nutrition, quantity, quality. She requires it. And when she's pregnant, the baby feeds off the mother. So the mother is not just, nutrition is not just for herself, but also for the baby in the womb. so that when you give birth to that baby, you're giving birth to a well-nourished baby that is, from 2.5 kg, upwards. And then of course we know you follow up with exclusive breastfeeding, complementary feeding, and so on and so forth. But also, in addition to some of this, hygiene is critical too. Parents and homes must also learn to handle, because no matter how qualitative the meal is, without hygiene in the home, the food could be contaminated, and that could become a problem for the family. And also, access to a hospital is also what the woman requires. She needs to go for her antenatal care clinics and so on and so forth. So what I'm saying in essence is the fact that with quality nutrition education, the mother should know what she or he or she what she requires even before she gets pregnant, when she's pregnant, after delivery, until that child grows up to become what God has destined for him to become.
All right. Talking about exclusive breastfeeding, we know the norm. It's been advocated. You are also an advocate for breastfeeding. But if you were to look at it, most people don't breastfeed exclusively. Some have, attributed that to timing, early resumption, after childbirth and all that. Do you think exclusive breastfeeding is achievable? If it's achievable, how do you think we can make it work? Because it takes a village to raise a child. Now, how do you think we can make exclusive breastfeeding work?
One of the best gifts you can give to your child is to exclusively breastfeed that child, because you're preparing him or her for a great future. I say this because within that breast milk that God is giving the woman for free, all that the child requires in the first 6 months of life is provided for. But starting from the colostrum, which is like the first immunization you're giving to that child, which helps build up the immune system of that child, of course, which would help him or her fight off diseases and infections that is within his or her environment. Exclusive breastfeeding is the best gift you can give to your child, and so every family, every home, and every community ought to do what, or has to, by all means, encourage, preach, campaign, and promote exclusive breastfeeding. And as a country, I believe both the government, both homes, and individuals have a critical role to play to achieve this particular feat. The government has tried. Lagos State government, for example, is one of the first states that passed the 6-month maternity law into promulgated that law or policy or act that is in place. That gives the working mother an opportunity to do what? To focus on the baby, to exclusively breastfeed the baby. And not just the mother too, they also extended 10 days to the husbands, because the woman needs all the support during that period. She's not supposed to do all the odd jobs at home and things like that. She requires the support of the family so she could have the time and be rested enough to exclusively breastfeed his or her baby. Then we as individuals, like I said, are really supporting the mother, and the mother making up his or her mind to do that. I know also that there's a challenge. We also have religious challenges, just as we talked of before. We are not religious now. I would say a situation where some women feel when they breastfeed, they are, how would I put it, for cosmetic reasons, that their breast will sag or so. Your breast, whether you breastfeed your baby or not, age, of course, age will tell with time. So please don't deny your baby, that precious gift from God by giving him or her, breast milk exclusively, and then with complementary feeding to 2 years. That's what the child needs to become a champion in his or her time. Yeah.
Okay, before we move to the next topic, I would like to ask a follow-up question now. You're an advocate of breastfeeding. The World Health Organization also has been complaining severely about aggressive marketing of formulas, baby formulas out there. Do you think baby formulas are important in raising or weaning a child? And when do you think that should come up? And how do you think we can, check this trend?
Okay. I gift to your child is still breast milk. And that's what we all Nigerians should push for, encourage and follow up. But there are situations, for example, where maybe because of sickness or one thing or the other, a mother cannot breastfeed. And in such situations, they maybe need to introduce baby formulas. And that's understandable because there's a reason why it couldn't happen. And if it's for a short while, after maybe the mother recovers or whatever, we can reintroduce the breast milk to the baby because it's still the best gift you can give to her. And so in rare cases, there's nothing you can do. But because of some of the challenges, it also that comes with feeding your baby with baby formulas. For example, making sure the utensils and what you use is clean at all time. Boiling, the process of boiling and making sure it's disinfected before you use. And also the situation where for economic reasons you find some families, maybe a tin of baby milk that's supposed to last say 3 days or so is used for a week plus. They add more water. Before you know it, the food loses, the quality and is not able to, give the kind of nutrient that the baby needs to thrive. So for such situation is understandable, but and that's why we have the code, the breast milk substitute code that's supposed to control how breast milk substitutes are advertised in hospitals, and also that encourages health caregivers to rather promote exclusive breastfeeding than promoting those breast milk substitutes. I think for us in Nigeria, we already have policies, we have strategies by SON and NAFDAC to be specific. And what we need now is enforcement of these rules, making sure that what the code says is what is implemented to the later, because the truth is that it's not just the family that is affected when these things are promoted, also the country in the long run will be affected if we fail to implement those codes. And so we need to enforce those codes. We also need to campaign and take it also even to the private sector. We know that the private sector, for them, it's about profit. But the truth is not always about profit. It's also about what you can do for your country. And one of the things they can do for our country is also, yes, you can sell your baby milk where it's allowed, but where it's not allowed, please don't advertise them. And then also, we have situations where at times healthcare givers are induced with trainings, with all sorts of things, so they could promote different brands where it ought not be promoted. I think for those in the private sector, that must be stopped, because you may think you're just making quick money now, but in the long run, you are harming the nation. You're reducing the quality of the workforce of the future. You're reducing the contribution that these children also probably give to the GDP of our nation and as a country. So I think it's a call to everyone to make sure that we observe these codes here in the country.
Food prices is a major trend now, a major development, and if you're to do a survey, many people have adopted the 101 style or 001 style just to meet up and just to just to, keep the body and soul
together.
Is there any relationship between food security, hike in food prices, and nutrition?
To some extent, you can't talk of nutrition security without talking of food security, because one of the major sources of the nutrient the body needs to thrive for its growth and development is, gotten from some of the food that we produce, and so it's a major challenge, because the economic situation is impacting all Nigerians, and it's making the money we have is not even able to help us buy what we need for our homes and for our families. And so I think it's a challenging time, but I think we can also we can overcome it if we go back to those days. And when I say go back to those days, I'm talking of this where every family has in its backyard a garden where they have tomato, they have pepper, they have okra, they have some of these things planted. They have hens, and they have cocks in their backyard. The hen lays eggs, and they can get protein meat from the chicken, or even some keep goats, some keep sheep and ram in their backyard. And so you find out that if you have some of this resource behind you, it will reduce the amount of money you spend daily to probably, provide the required nutrients for your family. But in this day and time we have, everybody wants to belong, wants to go to KFC, wants to go to Mr. Biggs, and so on and so forth. And the unfortunate thing is that some of the things you buy from this place, permit me to use this word, are junks. Junks in the sense that they only lead to obesity and overweight in some people who consume them consistently. While you have something in your backyard where you can prepare fresh, quality meals for your family. All you need is proper, nutrition education on what to take and how to mix them together, kind of meals that you need. The truth is that you don't have to break the bank for you and your family to have quality meal at home. You just need to go back to those days where you have a garden, where you have some of these things in your backyard that you can lean on when, of course, you don't have all the cash to do what you want to do. So, yes, the economy is biting, but we have to survive. And in order to survive, we must become innovative. And one of those innovations that has been proven to work is having some of these things in your backyard that you can lean on from time to time.
Okay, amidst not too encouraging economy now, let's look at lifestyle, the rising, trends. When you go to the eateries, you see complimentary drinks with so, buy this, you get this. What do you think can be done to change this narrative? Because no doubt, this is contributing to obesity and some other health challenges. And we are talking about how to tackle malnutrition. Is that a sign of healthy living when you go to the eatery and pick so packages?
Well, first and foremost, I must give it to businessmen. They're in business to make money. And one of the ways to get and keep your customers is to give incentive, like the free drinks you talked about, things like that. They're in business and they ought to make profit. But I also believe that the final decision on what you eat still lies with you as an individual and as a family. You ought to choose what you want. Like you said, the lifestyle of what we see these days is it's all about fast food, quick, in less than 5 minutes. Let me have it, let me eat, let me go. That's true. But not everything you get from the place is it's healthy for you. And so you must avoid those things that would be detrimental to your health rather than helping you grow properly. And so we just need to, people, like I said, we need to go back, to the farm where we have, in our farms, all the basic things we need for our food. Because eventually what you eat, there's this saying that's saying, let food be your medicine, which is the best way to go. And in order for food to be your medicine, you must choose what you eat. And it must be adequate in the sense that you take what your body needs per time, both in quality and in quantity, and not overdoing it. We don't have to copy everything that we see out there, because we ourselves, we must be disciplined enough to say no to those things that don't add to our health, because it's dangerous. You see, malnutrition is not just about what you eat, it's the aftermath of what you're eating. If our children don't get the best, you find that of course, stunting is out there, obesity is out there, non-communicable diseases, inability to contribute both to the family and to the entire nation productively. All those are, some of the challenges and impact of, copying this lifestyle rather than doing what is right. I think we should do what is right, and that is, go back, eat from, nature. That's the way to go.
Still on going back to the roots, going back to the basics, we have people who cut corners, in a bit to, try to meet up with some nutritional values and all that. But what are the right things to do? I've heard trans fats in recent times. How do you, ensure you still do not lose out of nutrition? What are the basic things as an advocate of nutrition? What are the basic things you must, do? I don't have to fry, if you would tell someone you don't have to reuse or recycle your fried, the oil gotten from the fried meat or fish and all that, they will tell you, Uncle, go and sit down. It is not, it is still the same oil. So how do you think we can, benefit from this, achieve the nutritional value, desired nutritional value?
Okay, then you've said it, you just explained some of these things, the things we ought not do. The case of trans fat, like you said, it's not good for us and things like that. I think it all boils down to education. Trying to make sure we help the people overcome ignorance of the impact of some of these practices that are rather harmful than helpful to our health. I think working with the media, we need to take these messages to the grassroots, to the those high and mighty, and even to those that are downtrodden. They need to know the impact of some of these practices, that they are not healthy, and the outcome of practicing some of these things in the future. It's education. It needs to be in the radio. We need to talk about it, that what you eat will impact on you eventually. So choose what you eat and choose wisely. And we need to get it out there. The messages, the education. We need to help people understand some of these things that they must do and must not do. Okay,
let's move on to policy now. Roadmap to reducing malnutrition. It's not enough to allocate budget. It's all about implementation and how we actually reach the targeted audience. Now, what is your call to action as we move on?
Okay, first of all, I'll use this opportunity to congratulate and say kudos to states and even at the national level for developing the policy and also operationalizing it in the strategy, the National Multi-Sectoral Plan of Action for Nutrition, that has also been domesticated in states, including Lagos State, of course. That's like a huge step, because now we know what the problem is, we know what we need to do to fix it, and number three, we also know how much it will cost us to fix it. And within that document, we also have an M&E framework that's supposed to help us monitor implementation. And within that document, it provides, for them to also have what we call midterm reviews to check how far they've gone. All that is available. So I would say we have the roadmap that we need to reduce malnutrition at the national and in some states, and now to be specific, in Lagos State. Now, the next point of action is, these strategies is costed for 5 years. The government needs to, now these activities and interventions that have been captured in the plan, so that, there's availability of resources to implement those interventions. And not just allocations, because we have some who have allocated money, but also move forward by ensuring that these monies are released as at when due. Now, let's take for instance a SAM case that is severely acute malnourished child. The life of that child is at risk. And the fact is, if you don't treat that child will eventually die. So that means that challenge that child is facing is time sensitive. And in Lagos State currently, I know that the NDHS said, I think less than 6% of the children are wasted. So you can imagine the number if you look at that 6% of the total number of under 5s in Lagos. It will run into millions of children. And so if, for example, you're supposed to release monies in January, for example, or in March, for them to implement, interventions like, ensuring that there are CMAN centers and there are places where they can access RETF and some other things, and you fail to do that, the implication is that between, for example, January and March, you would have lost some of those children. And what we're doing is that we're losing the future of our country. We don't know, maybe the next president is among those children who could maybe transform things. And so the state needs to not just allocate adequate resources, release it as at when due, because some of these challenges are time sensitive. And also we need to invest in preventive measures, promoting exclusive breastfeeding. Let it be in our radios and television that one of the best gifts you can give to your child is to exclusively breastfeed that baby. I believe the government has a critical role to play in making sure that everybody, every home, in all nook and crannies of the state hears, this information and practices them. For me, I believe if this is done, it will go a long way. And then to us individuals also, like I said, go back to nature. Those of us who have the ability to produce our own food, please do so. And those who have the ability, who understands and knows, the steps you need to take, for optimal nutrition of your family, please practice them and tell your neighbors too. And of course the media, like you said, shout it to the rooftop. Redistribute these messages, get it to the downtrodden, let them know what to do part-time. I believe for me, that's what we ought to do. Every hand has to be on deck to make sure we kick malnutrition out of Lagos State and Nigeria as a whole.
Sunday, Okoronkwo, Executive Secretary, Civil Society Scaling Up Nutrition in Nigeria on Roadmap to Reducing Malnutrition. Thank you so much for your time and expertise on the program.
Thank you very much. Thank you for being partners with CSR. We're glad to contribute our quota to reducing malnutrition in the country. Thank you.
Alright, it is still Sound Health on Lagos Television. Trending Health Report is up next. Please stay tuned. Alright, this is where we say thank you on today's episode of Sound Health. Remember, we all have a key role to play in ending malnutrition. Scale up nutrition by eating only nutritious food. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LCB Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.